So I'm here to welcome you all. My name is Jennifer Crouch. I'm the development director at Village Reach, and we're glad that you're here today. Thanks for taking time to be with us to learn more about this milestone and milestones ahead for Drones for Health with Village Reach. I'm going to be joined today by two of my colleagues, Dr. Olivier Defoe, who is the director for Drones for Health at Village Reach, and Innocent Manjeni, who's a supply chain advisor and lead for the Malawi Drones for Health project. So Olivia is going to speak for about 15 minutes or so, and then he and Innocent will answer your questions. And so speaking about that, there is a Q&A button at the bottom of your page. And so you can submit your questions there at any time. I'll try to answer the ones that are super simple. Ones that are more complex, we'll save them for the end for Olivier and Innocent to give you more details. Okay, over to you, Olivier. Let's get started.
Thank you, Jen. Hi, everyone. My name is Olivier Defoe. Many of you know Village Reach, but for those who may be new to us, Village Reach is a non-governmental and not-for-profit organization headquartered in Seattle, and with country offices and staff based primarily in sub-Saharan Africa. Village Reach has been working for the past 20 years to improve the way health products such as vaccine, medicine, and laboratory samples are transported in low and middle income countries where we work. At Village Reach, we aspire to a world where every individual on Earth has access to the healthcare services she or he deserves to thrive. Do you ever wonder how you could be part of something truly meaningful, something unique, but also impactful, something that has the potential to change the quality of life of not only hundreds of people, thousands of people, no, millions of lives? Well, I'm here today to invite you to come along with us on a journey. As Village Reach and the government of Malawi scale up nationally the first ever two-way drone delivery service in the world. A service that will make access to life-saving health products more equitable and improve the prevention and the treatment of devastating disease such as HIV, malaria, even COVID-19. A drone delivery service that will impact the life of 700,000 people directly and close to 3 million people indirectly, people who live in remote and hard to reach areas and thus have difficult access to medical products and services. Especially now, during the pandemic, drone delivery has become even more relevant as it provides an equitable solution and make access to healthcare services not an option, but a right for all humans on Earth. Since 2015, Village Reach has been at the forefront of the exploration of drone technology to transport life-saving product in challenging environment. As of today, Village Reach has conducted 5 drone delivery projects in 5 different countries, and 3 of them are still currently active. This operation not only allows us and the government to gain experience with this relatively new technology, but they also help generate hard evidence on the benefit of the supply chain, performance, and cost. These last 5 years were mixed with success, like in the Democratic Republic of Congo with the first drone-supported vaccination session in West and Central Africa, but also some setbacks. But at the end, that experience made Village Reach one of the most know-how partners in the drone delivery space and is allowing us to lead the way on the international stage. In countries like Malawi or Mozambique, which have a large rural population, difficult terrain, flooding, and limited road infrastructure are barriers to health product delivery. When vaccine or medicine cannot reach rural communities and patient sample cannot be rapidly tested, the health of entire communities is at stake. Children may fall sick and die from malaria or diarrhea, especially during rainy season. Women may not survive complication of pregnancy or childbirth. And infectious disease such as HIV, tuberculosis, and COVID may spread faster. In fact, hit hard by a second wave of COVID-19, Malawi declared last January a state of national disaster. Drones have the potential to play a transformative role, particularly in healthcare, where they allow us to overcome challenges in infrastructure, logistics, optimize supply chain system, making them more effective and reliable, resulting in increase of the health worker efficiency as they spend less time on fetching product and more time on actually taking care of their people. In many hard-to-reach areas, drone delivery may provide significant economic and time reduction benefits in transporting life-saving product. They also enable the transformation towards the next generation of supply chain, a supply chain more agile, more responsive to the need of the communities. All in all, ensuring that everyone, no matter where they live, has access to high quality healthcare. In addition to the potential lives saved and improved through timely access to medicine, vaccine, and lab result, there is a socio-economic spillover effect. Healthier workforce for the country, an increased confidence in the public health system, and jobs created by exploring the future generation, by exposing, the future generation to the latest aerial technology, allowing them to develop valuable new skills. Drone can also spur new investments and open the door to infrastructure improvements, advanced aerial sensing application, and advanced air mobility. Of course, drones do not solve every problem and are not suitable in every situation. So to help solve the inequity of access, Village Reach looked for a drone solution that can travel at least 100 kilometers with a package of a minimum 3 kilos. Remember, the syringes, the vaccine vials, samples, laboratory samples only weigh a few grams. So for the challenge that we are trying to solve, we don't need a drone that can carry hundreds of kilos of product. We were also looking for a drone that can land at the destination and bring back product like laboratory samples, medical reports, or even letters, acting almost like a postal service for health workers. Again, you need to remember that we are targeting remote and hard-to-reach community, many of which lack modern means of communication like cell phone, internet, or a postal service. Finally, we needed to find a technology that could easily be adapted to resource-limited setting, easy to deploy, maintain, operate locally, and requiring skills that are transferable to the local workforce. Well, we found these characteristics in an Australian drone service provider called Swoopero. In fact, Swoopero was selected separately through 3 international competitive bids to operate in the DRC, the Democratic Republic of Congo, Mozambique, and Malawi, where we work. And those evaluation and selection were done in partnership with each country's civil aviation authority, aeronautical engineers, and Ministry of Health. The picture that you see on the left there show local drone hub managers preparing the Swoopero aircraft for takeoff. And the picture on the right was taken actually in Democratic Republic of Congo, showing a recently hired and trained drone pilot using 3D printer, three-dimensional printer to produce a part of a wing that needed to be replaced. So imagine this is taking place in the middle of the equatorial forest on the shore of the Congo River in the largest country in sub-Saharan Africa. 3D printing, amazing. Africa, and more specifically Malawi, has been a global leader in the field of drone with one of the first proof of concept studies demonstrating the safety and the feasibility of drone transporting lab sample. The first humanitarian drone testing corridor where companies and academic institutions can come and test the drone technology. It is also in Malawi that the first African Drone and Data Academy was developed in partnership with UNICEF for students from all over Africa to go to learn how to build, operate, maintain, and fly drones. Finally, the civil aviation of Malawi was among the first in the world to draft a set of regulations to fly drones in Malawi and establish a national drone working group with support from Village Reach. A lot of first time here. That is why we are so enthusiastic about also launching the first national two-way drone delivery service in Malawi. Several years ago, the governor of Malawi took the risk and the bold commitment to explore and invest time and effort into the drone technology. And with this program, Malawi will maintain its position as a leader in the space. What Village Reach is planning to do over the next 15 months is to build on the successes that the government of Malawi, in collaboration with SuperAero, has had over the last year. SuperAero has already shown that their technology can reduce a 90-minute car ride on roads to a 9-minute drone flight. And know that that road is actually inaccessible on the rainy season. Another example, in the north of Malawi, SuperAero drones were able to reduce a 3-hour journey one way by boat to a 12-minute flight. Over the last year, SuperAero drone flew over 1,800 flights covering over 60,000 kilometers and transported vaccine, PPE, lab sample, including COVID-19 sample, to and from 25 health facilities in 2 districts. They also responded to over 67 emergency calls to deliver life-saving anti-rabies, antivenom vaccines, and oxytocin, saving mothers during complicated childbirth. Starting on May 1st, and over the next 15 months, we will not only sustain those operations, but more importantly, we will scale up the drone delivery network to 20 out of 28 districts in the country and help the government ensure equitable access to life-saving products and services in over 100 health facilities identified by the government as the hardest to reach when using traditional mode of transportation. By mid-2022, we anticipate Malawi will again have crossed a major milestone, becoming the first country in the world to deploy two-way drone for medical delivery throughout most of the national territory. But we want to do more, though, and beyond Malawi alone. In the next year, we also intend to support the National Institute of Health in Mozambique with the deployment of an emergency program to accelerate the COVID-19 testing in one of the provinces hardest hit by the virus. We will fly daily between 8 hospitals to pick up and drop off COVID-19 lab samples. And as the country receives COVID-19 vaccine and more people are eligible to receive it, the drone can also help with COVID-19 vaccine distribution at the request of the Ministry of Health. At Village Reach, we believe that the world is at the beginning of a revolution in healthcare logistics. Over the last 5 years, Village Reach, with its government partners from Malawi, Mozambique, and DR Congo, has demonstrated that drone technology can be used safely and reliably in low and middle income countries to bring the life-saving product that everyone deserves closer to them, closer to who need them, no matter where they live. And it is now time to expand our reach and scale the impact that this transformative technology can have in people's life. Africa has been a global leader in the field of drone, with the first national scale drone delivery program launching in Rwanda, the world's first drone delivery of COVID-19 vaccine taking place in Ghana. Africa countries are showing the rest of the world the social and economic value that can be provided by this technology. So if you believe in a world where each person deserves the health care needed to thrive, join us in this life-changing program and help us scale the first national drone delivery network in Malawi and the COVID-19 drone emergency response in Mozambique. Thank you for listening, and over to you, Jen.
Thanks, Olivier. If you could go for just a couple slides. So Olivier is, I work with Olivier all the time, and his enthusiasm is 100% genuine and contagious. He is just as excited about drones as it seems like he is. We're about to turn attention to questions in the Q&A. We do have one, but I'm very interested to see what other questions you have. So please, put stuff in there, or I will ask them questions about things I want to know about drones. But first, I wanted to make a really quick announcement, because it's been an exciting few days for us at Village Reach as we've been gearing up to talk to you about this. Last week, Focusing Philanthropy, which is a funder based in the United States in California, offered to match all gifts to support this effort up to $1 million. And so that means that right now, a gift of $1,000 is worth twice that much. We're really honored that Office Timeline, many members of the Office Timeline friends and family are on the line with us right now, actually. Office Timeline is kicking off the campaign with the very first generous gift on behalf of their employees and families. And they want to challenge others to join them. So I want to thank both Focusing Philanthropy and Office Timeline for truly amazing support. And if you're inspired and want to be part of this, we'd love to talk to you about it as well.